So good morning, everyone. Confirming at first that you can hear me and see me well. Perfect. Thank you for all the attendees that have joined us today, as we are extremely pleased to be connecting with you all on the occasion of London Global Cancer Week in the yearly session that the Children's Cancer Centre hosts. This year, we are doing it differently, as we are coming together in partnership with renowned patient organizations like King Hussein Cancer Center and Foundation, Macmillan Cancer Support, and Friends of Cancer Patients, to discuss survival stories and the contributions that such organizations have had on patient journeys. As much as the word cancer brings about feelings of despair, weakness, and fear, as much as we promise you today that our panel will bring you stories of strength, power, and hope. Hence, the title of our panel today, The Strong, the Powerful, and the Hopeful. Rosie, if you could share the screen. Thank you so much. The Children's Cancer Center of Lebanon today is hosting this panel of brave survivors as a living example of the saying, what doesn't kill you certainly makes you stronger. Inaugurated in 2002, the Children's Cancer Center of Lebanon is a regional reference NGO, pioneering in providing access to treatment for children with cancer at no cost to their parents and with complete dependency on donations, proudly reaching an average cure rate of 80% and with a yearly required budget of $150 million. As one of the 80% cured patients myself, I cannot but confirm that yes, we do call CCCL a home of hope, with more than 5,000 fellow patients treated to date, more than 6,000 medical consultations, and this year having 500 current patients on treatment in the center. I am certain that you are eager to meet our speakers. However, allow me first to iterate on some housekeeping rules for this session. So at first, you are encouraged to keep your mics muted at all time. And second, for any questions that you may have, which we hope they will be many, kindly to keep them till the end for the Q&A session or write them in the chat box. So we are joined today, obviously, with 5 beautiful survivors representing their patient organizations in the region, such organizations who play a pivotal role in providing opportunities of survival, health, and hope, while also pioneering each in their communities through enhancing healthcare measures to provide better quality of lives for the people with cancer. Each of today's panelists has a distinguished journey to share, out of which they triumphed and gained another chance at life. I will start accordingly with Christine. Christine Young is joining us from Macmillan Cancer Support. Christine was diagnosed with Hodgkin's lymphoma disease at the age of 18 and now works for Macmillan Cancer Support as a partnership quality lead. In this role, she supports a range of professionals working in London to deliver excellent person-centered care for people living with cancer. The Macmillan Cancer Support is the leading charity in the UK, dedicated to providing comprehensive support to individuals and families affected by cancer. But the beauty of it is that it also provides emotional, practical, and financial support, ensuring that no one faces cancer alone. With a range of services, including access to expert information, healthcare professionals, and a supportive community, Macmillan is committed to helping people live life as fully as they can, from diagnosis through treatment and beyond. They work in partnership with the National Health Service and in collaboration with communities to ensure that everyone with cancer has access to support that meets all their needs. Now, I hand it over to you, Christine.
Thank you very much. Hello, everybody. Good morning. Yes, I was diagnosed with Hodgkin's disease in 1980 when I was 17 years old and living in the States. I'd had lumps in my neck for quite a long time, but the pediatrician who was looking after me just thought they were swollen glands. When I later went to another doctor, he sent me for a number of tests, some of which were quite painful and frightening. I remember one of the worst ones for me was an X-ray called a lymphangiogram, which involved having contrast dye injected between my toes. When the test was finished, I was quite keen to get off the table because my toes were stinging, but the technician had actually forgotten that I was there because I was in a side room and I'd been told not to move on the table. I remember feeling really powerless at that time until my dad heard me shouting, was able to get somebody to help, and I did eventually come down from the table, which was great. After I had all the tests, it was confirmed that I had stage 3 Hodgkin's disease. The disease had spread or started to spread into my spleen, which had to be removed. And that was quite a big operation. I remember being hunched over for a number of weeks after that. I also had to have radiotherapy. What I remember mostly from that was really being exhausted. I also remember with my 13-year-old sister watching as clumps of my hair fell out from the treatment. We laughed about it at the time, but I can now see with hindsight that that was nervous laughter, because obviously it was very unsettling. Nevertheless, the treatment was a success, and my Hodgkin's disease never returned, which is wonderful. It might be worth saying that, again, this was in 1980, but during my treatment and diagnosis, no one used the word cancer at all. Not my family, not my friends, none of the health professionals who were looking after me. In fact, the doctors told my parents not to use the word cancer and not to read anything about the disease because it might upset them. It's very difficult to imagine that happening now, I think. In preparation for today, I've been thinking a lot about what helped me to get through that time. And one very, very big thing was that the doctors and nurses who were looking after me saw me as a person and not just as a patient. I remember there was lots of care and warmth and even humor from that time. In particular, the surgeon who removed my spleen, he cared enough to think about the fact that I might want to have a family later on. So when he removed my spleen, he actually at the same time moved my ovaries behind my uterus so that that would act as a shield. It would shield my eggs from the radiation. Years later, I was pregnant and with my daughter, who we called Hope. And when I saw my doctor when I was pregnant, I asked him if he'd ever seen anybody else who'd had that procedure done to protect their fertility. And he said he'd never seen anyone who'd had Hodgkin's disease have a baby before. So as you can imagine, I felt extremely grateful, and I feel very blessed about that still today. I also had lots of other people who were very caring and supported me as well. After my operation, my mother came to the hospital every day and rubbed talcum powder on my back. I felt very, very cared for at that time. And also it was just so nice to have some physical comfort as well during that difficult time. My friends were there for me too. And some of them even invited me to their university parties because I'd had to delay going to university myself due to my diagnosis. When I did go to university, when I started university a few months later, all of that support that I'd had was stripped away from me. I was away from my family and my friends, again, all the health professionals who'd looked after me. And those first months were some of the hardest months of my life, really, really difficult. I'd had no psychological support during my diagnosis and treatment. No one had even suggested that there might be an emotional impact from what I'd been going through. And I don't really remember much of that time other than what I'm sharing in this talk. I blocked most of it out, I think, and probably discounted the significance of what was happening to me. Also, there was no support, emotional support from my family either. And my mother and sister have since said to me that having had someone to talk to at that time would have made a big difference to them as well. Thank you.
Thank you so much, Christine, and thank you for being that brave and flagging really what was missing back then in your journey so that we can make sure that we're providing this to cancer patients now. Thank you for that. So with this, we can move to Jad Bilbul, who is joining us from King Hussein Cancer Foundation and Center. So the King Hussein Cancer Foundation is an independent, non-governmental, non-profit national foundation that was founded in 2001 by royal decree and headed by Her Royal Highness Princess Ghida bint Talal, who personally presides over all management functions and operations of the foundation and the center, along with the board of trustees. The center is known with its vision that is dedicated to saving lives with the highest standards of comprehensive cancer care and control, and engaging society in the fight against cancer in Jordan and the Middle East region. A vision to be realized through a mission of awareness, research, education, and nonprofit insurance coverage to patients. Hand in hand with KHCF comes KHCC, or the King Hussein Cancer Center, established in the same year and honorably bearing the name of His Majesty the late King Hussein of Jordan. KHCC stands as one of Jordan's crown jewels and the pride of the Arab world, as it is accredited by the Joint Mission Commission International as a disease specific cancer center, making it the first center in the developing world and only the sixth worldwide to earn such a distinction. The center provides comprehensive cancer treatment for adults and pediatric patients, following international standards and protocols, while also having the largest bone marrow transplant program in the Middle East. At the center, Jad Bulbul received his treatment to his stage 3 testicular cancer diagnosis at the age of only 17, which occurred to him additionally to being born with a bleeding disorder, specifically hemophilia mild A. Jad underwent a 6-month treatment protocol, which was concluded in October last year. And Jad, now aged 18 years old, is studying physiotherapy at the University of Jordan. His message to all cancer patients is to have hope, because as complicated as it might look when you are in the moment, everything will be fine. And I confirm that. Jad, to you.
Hello, everyone. I'm very pleased to meet you all. I hope you can see and hear me clearly. I'm 18 years old, as Janine told you. I got diagnosed with cancer at 17. It was quite a shock when it started, but everything that got provided to me by KHCC, my friends, my family, and my extended family even was very, very supporting mentally and physically. It's quite fresh, so I don't have anything much to say, but it's always better than I think. Like I still think it's a miracle what happened with me, because at some stage I kind of lost hope, but after that, like it was very, very easy when I got done with my treatment. It was very relieving, and I got every ounce of hope I could get. My friends, my family, they all helped me through my journey. It was not a long journey though, it was only 6 months. It was quite tiring, but it all got better.
Jad, we lost you.
Hello?
Yes, now
Can
you're
you?
back.
Yeah. I was born with hemophilia. I don't know if any of you are familiar with it, but it's like a bleeding disorder. My factor 8 in the blood is like it's not there as much as a normal person. So it was quite challenging to get like a procedure done and have chemotherapy and every treatment I had to get while being like a patient of another disease. But I like they all were very, very professional. KHCC especially, they had all the knowledge they could have to help me get through this. That's all I think.
Thank you so much, Jad, for sharing your experience, and good luck in your studies as well. So it's great to see that you're doing physiotherapy also related to health.
Yeah.
We move now from Jordan to Lebanon with Malak, who will be sharing her journey at the Children's Cancer Center of Lebanon. So, this center, additionally to what I mentioned in the beginning, has been contributing to patients' lives for more than 20 years in the country and providing end to end medical care, as well as contributing to the overall wellness of patients and their families during the patient's journey. And they usually do so through sessions including activities like yoga, expressive art, expressive music, and drama. The CCCL initiated the Champions Circle as well to empower survivors like us and foster mutual support while also prioritizing awareness and education about cancer. To ensure sustainability of providing for patients, the center actively enhances fundraising efforts and implements cost containment measures to ensure continued support. Expanding its global reach, CCCL emphasizes the urgency of donations to support its mission of saving lives and celebrating hope, doubling fundraising efforts both in Lebanon and abroad. So Malak has survived a Hodgkin's lymphoma diagnosis at the age of only 7. And already now turning 18, she is studying agricultural engineering at the American University of Beirut. As a cancer survivor, Malak aspires to the best version of herself to help other cancer patients get out of the negativity she experienced during her cancer journey, hoping to be someone they can talk to and feel comfortable with. As a future agricultural engineer, she dreams of having a farm outside of the city filled with vegetables, fruits, and animal produce that will eventually become her own business. Malak, to you.
For this lovely introduction. At first, while on my deathbed on cancer, while having cancer, I really felt hopeless. Yet at the same time, my family, even also the doctors and the nurses, they didn't let me feel that way. They would always come wearing costumes. They would wear anything to make me feel, to make me happy or to even laugh. Eventually, I got out of it. I don't even remember that much what happened exactly with me. My brain chose to not remember all the bad stuff. Yet now I'm in the cancer survivor circle. Sometimes at first I felt lonely and I didn't want to be there. I didn't want to be remembered as the girl who got cancer. But eventually I found new people. I found one of my closest friends there. And this really helped me to see the world or cancer not just as a bad experience, but an experience overall. Some of which are bad and others are good. As I said before, at first I really didn't feel comfortable joining even the group or the circle or going to the activities that they did, such as the yoga sessions and whatever. I felt like the cancer phase was always catching me up and hit me to reality that, oh, I had cancer before. But this mentality had changed now recently, to be honest. I went to a therapist and she helped me out really to see that cancer didn't just make me, it made me who I am right now. And it made me even stronger, and it made me even think about what I had. No, what I experienced was an experience that now I have all. Sorry, it's all about hope and the bad experience, like the near-death experience, really made me think that it's not just a bad experience. I went through it. I can go through anything now, and yeah, that's it.
Thank you so much, Malak. It definitely shapes who you are today, and I'm pretty sure that with the dreams I see here and with the commitment you have to what you want to achieve, you're gonna definitely shine. Thank you so much, Malak, for that. Now we move back to also Rachel Murphy, who is also part of the Macmillan Cancer Support. So Rachel was diagnosed with thyroid cancer in London when she was 19 and now works as a senior innovator at the UK's leading cancer care charity, Macmillan Cancer Support. She is passionate about advocating for a holistic approach to cancer care in young people. Rachel, floor is yours.
Thank you very much, Janine, and hi everyone. It's great to be with you this morning. The sun's just coming up in London. It's very, very early. It's only 7:30 a.m. So yeah, great to be able to share my story with you today. I was diagnosed with thyroid cancer in 2008. As Janine has said, I was 19 and I was in my second year at university. The road to my diagnosis was actually quite long. It stretched over the course of about a year because initially my GP, that's general practitioner in the NHS, dismissed this really significant lump in my neck. And it was only after really advocating for myself that it was taken more seriously. It then took a series of first, second, and third opinions from different experts before the diagnosis was finally delivered. And it was delivered really bluntly during an ultrasound where the consultant reviewing the imagery said, well, you've got cancer. And the sonographer was visibly shocked and had to apologise for how the consultant had behaved when he left the room. This was the start of what I now understand to be a very traumatic experience for me, something that has had a lasting emotional impact that I am only now really able to understand and address. My journey involved treatment, which I'm pleased to say was a success, but that really was it. There was no discussion or offer of wraparound support to help with the more emotional and social effects of living with cancer as a teenager. How putting my life on hold and the fatigue would affect my life and relationships at such a developmental stage. There was no consideration of the fact I was barely an adult when I was visiting adult clinics and wards. There was no consideration of the fact that I'd actually lost my dad to cancer when I was 12 and that my own diagnosis might be a re-traumatizing experience. So now I'm 35 and I can understand that I have really contained the emotional impact of my cancer experience for that time, and that this trauma has manifested through lots of different symptoms, including hypervigilance and actually physical pain. So more the psychosomatic effect of what I experienced. But I'm now on a journey to process and resolve this trauma, and all those symptoms are diminishing month by month, which is really great to see and feel. I'm really encouraged to hear that well-designed holistic support is increasingly available for young people. It's really great to hear Jad and Malak talking about that. I have absolutely no doubt that my life experience would look really different and easier if I'd been able to access emotional and social support from the start of my cancer journey. Thank you.
Thank you, Rachel. So now we move to Kiran, who's joining us from the Friends of Cancer Patients. Kiran is actually replacing today Abdullah Jassim, who was unfortunately unable to join. Thank you, Kiran, for making it. I'll just give you a few words about Friends of Cancer Patients and then hand it over to Kiran to introduce themselves. This organization was founded in 1999 and is dedicated to instilling hope and compassion, not only in the lives of cancer patients, but also to their families, donors, and the community. Their vision is to minimize cancer's impact on people's lives, and their mission involves advocating for health and providing comprehensive support during the healing journey. Friends of Cancer Patients is driven by 4 core values under we care, we collaborate, we pioneer, and we aspire. And they operate through 3 pillars. The first is patient access, offering financial, spiritual, and psychological support. The second, under community engagement, focusing on awareness and continuous support. And the third, on advocacy, targeting cancer-related health issues internationally as well as living healthy. So with this, I hand it over to our speaker.
Hello.
Hello.
Yeah. Can you
We
see
hear
me?
you. We hear you and see you. Yes.
See me?
Yes.
Okay. I'm from the United States. I moved to Dubai in 2019, and my first kind of symptoms were I started feeling pain in my abdomen area, and when I was peeing, I started feeling pain, and it was kind of random. Like it was a shock because I've always been healthy. I'm a skinny person. I play sports, so never really had too many health problems. And at first, I started begin. It was like some type of stomach infection or something of that nature, and I began to get scans and MRIs, and they found a mass inside of my stomach, and that's when soon after that I got a biopsy, and they figured out it was Ewing sarcoma. So that was last year when I was 16. Kind of happened out of the blue, and then I started my treatment in December, chemotherapy in Dubai. So it came out of nowhere, but yeah, starting off it was, what was to be expected. Exhausting, getting chemo every week, 5 days at a time, and then one day, and then one day. And I was just a kid in high school, so it kind of kept happening out of nowhere, and it was an adjustment. But I was very thankful, and I've been thankful for the nurses I had at Medic Clinic. Always having a smile on their face, always having positivity whenever I come, and just making it easy and taking the stress off of me. And I'm actually still getting treatment. I'm on my last 2 weeks, and then I'll be in remission. So yeah, it's been a process. I had surgery in March to get the mass removed, and then I had radiotherapy in June, and it was exhausting. But main things I want to say is just, one of this year has unexpectedly been one of the best years of my life. I really expected it to, you hear you have cancer, you expect it to be bad, and you in the house, sitting all day and feeling bad. But I've just learned so many lessons, and I really feel like if I can make it through this, I can make it through anything. So it's giving me so much strength, positivity, and yeah, that's all.
Thank you so much, Kiran, for joining, of course, on a short notice, and also speedy recovery. So only a few milestones to go, and
Yep.
hopefully you
Thank
start
you.
feeling way better.
Yeah.
Great. So we've heard a lot about our fellow panelists, and we've heard a lot about definitely the challenges throughout the journey and the importance of the right support alongside with the medical treatment that really impacted those who had the chance to have it, but also for those who didn't have the chance to have it. It was one of the major needs that they flagged as well. As for myself, I'm also a childhood cancer survivor who had the chance to receive treatment at the Children's Cancer Center in Lebanon. It's true it was 19 years ago, but such journeys cannot be forgotten, so I still feel as if it was yesterday. The thing I would like to pinpoint on the most is not only the fact that I received the most advanced medical treatment in the center that was available for me as I was in Lebanon, but also the right support that was provided to myself and to my family that helped me overcome this difficult journey and not only survive, but also help me equip myself for life after cancer. And the beauty about being in such a center is that you certainly have a key objective to make sure you're surviving, but the people equip you throughout the whole thing, bringing to your subconscious the idea of, I need to get myself ready when I go out to continue life where I left it. And to me, 19 years ago, I was a teenager and I was struck with the news of having osteosarcoma. Certainly, I did not understand the word. They had to explain it very thoroughly to me to understand my case. But I knew that I had to pause my life for now to fight cancer. Quite a difficult thing to introduce to any teenager, which by themselves usually have a lot of complex situations to navigate. But the thing that was mostly also challenging to me was that I was in an academic year that was a stepping stone to high school. And it did not only require me to pass my exams at school, but it also required me to sit for official exams that we have in the country so that I am eligible to move forward in my academic years. So given my diagnosis, I had to be out of school. So I was out of school for 1 full year, unable to sit with my friends, of course, given my low immunity and not being capable, given the surgery I had, to really be mobile and go here and there. What I still remember till today, and I'm grateful for till today, is that I really wanted to sit for those exams because I didn't want to lose my academic year. I wanted to move through with my friends when I finished my treatment. And this is what was beautifully done and shaped with the help of the center and also friends to be able to submit for an exceptional approval for the Ministry of Education to allow me to sit for those exams from my hospital bed in the center. Because definitely I was immunocompromised. I couldn't go to the big school centers where they hold these exams and sit for long hours on wooden chairs and attend for those. And we got the approval. So during that period of time, I received the right tutoring, be it from the center or for my friends, to be able to catch up on my education and be ready for the exams. And when the time came, I sat for the exams and I passed it with distinction. So 1 year later, I made it to high school, joined my classmates exactly after 1 year of being fully absent. So to me, it might sound like it's just only 1 year, it's okay. But to me, it meant a lot because I was there and I was proving that, yes, I had cancer. It was a journey, but it didn't stop me. I want to continue. I want to achieve my dreams and my goals that I aim for. So the beauty about it as well is that the center took it further, and they became an accredited center from the Ministry of Education for all patients to sit for their official exams at the center and not allowing really cancer to step in the way of their education. So this is one of the small examples that I can give that were pivotal in my survival journey, that brought a lot, of satisfaction, of fulfillment, and of course, of drive and hope to keep fighting to make it happen and to survive. So 19 years later, I'm definitely very proud and very grateful that I was able to fight this fight and win the battle against cancer, as we call it, but to also to have been surrounded with unconditional support and medical care, be it from my family, my friends who stood by me the whole time, but also from the center, which even nearly 20 years later, whenever I pass by, I still get, the warmth, the hospitality that I used to get back then when I was a little child. So this is extremely important for us to have and to foster for any potential cancer patient. Cancer by itself is an extremely difficult journey emotionally, physically, and mentally. So having all of that support should be the minimum right of a cancer patient so that they have higher chances of survival. So I will pause here and we can move to our Q&A sessions. So if anyone from the audience would like to ask us questions, feel free to raise your hand, to write it in the chat, and we can take it as well. So in the meantime, I can actually ask a question to Christine. So Christine, you mentioned that definitely you are a survivor now, and with the work that you do, you certainly advocate for cancer at Macmillan Center. And you mentioned the importance of support when back in the day in the 1980s, it was not provided to you. So working in this organization, how does your past experience or journey influence your day-to-day work, and how?
Well, yes, thank you very much, Janine. Yes, I mean, I think the reason I joined Macmillan Cancer Support was because I wanted, after having my own experience and being so grateful for having survived and also for the really high quality care that I had, I wanted to work to make a difference to other people who were living with cancer. So I applied for a job with Macmillan, and the role basically involves working with health professionals and also other professionals as well to, again, to really work with people living with cancer, again, as people rather than just as patients, which is obviously something that's very important to me, and to basically empower them so that they can actually take an active role in the planning and delivery of their care, so it can be tailored around what matters to them most. So really this kind of person-centered focus is what I'm trying to support the health professionals with doing. I'm also trying to encourage them to reach out to some of the communities that traditionally have been underserved or that haven't had the chance to access healthcare in the same way, so they can plan events and build relationships and again involve those patients in the kind of co-design of their care, so that more people, more of our communities have access to that kind of opportunity. We have a National Health Service in England, and one of their priorities is to actually tackle health inequalities over the next 10 years. And people who have cancer are entitled to have personalized care, and particularly something called holistic needs assessments, which is kind of what we've been talking about a lot today, I think. It basically enables people with cancer to think about and identify their practical needs, their emotional needs, their social needs, and their physical needs as well, so that those needs can be identified and addressed as soon as possible, So I work with health professionals and others to ensure that those health needs assessments are carried out. And there's also kind of high quality conversations around each person's care plan so that they can be tailored around what matters most to them. So I think it comes from that. I think I take with me in my job a real appreciation of how much of a difference quality cancer care and health professionals can make, and trying to support them as much as I can to offer that personalized approach to each person living with cancer that they meet.
Thank you so much, Christine. I would like to also ask another question to Jad. So Jad, I know you're like finished it very fresh. You finished your treatment journey less than a year ago, and you mentioned that you were very well surrounded in King Hussein Cancer Center. So my question to you is that which type of support that you felt you received at the center that has made the biggest difference in your journey?
The support I received at the center was basically the doctors, the nurses. They were all very positive. They were all very, like, they tried to make me feel welcomed. They didn't endure like stress or anxiety on me. They always like tried to make me feel what should I say? They always tried to make me feel stress-free, and they tried to make fun activities. They were all friendly. They allowed my parents to stay, my friends to come over, even though my immunity was very low. But we took the precautions, of course. But it was all very refreshing. They provided all the support they can get, and I'm very thankful to have my journey done at the King Hussein Cancer Support.
Thank you, Jad.
You're welcome.
So a question to you, Rachel. Since you are at both ends as well, like Christine, so post your survival journey, have you noticed in the UK, for example, any policy changes in the country that now tackles, the inclusion aspects of cancer patients in shaping the way forward?
Yeah, I think I've certainly seen, even within Macmillan, so where Christine and I both work, a real recognition of the importance for designing with rather than designing for people with cancer. I know Christine's spoken about person-centered care, but I think that's been a journey for our organisation in really recognising that the most effective solutions for people really are born out of people's own experiences, and that we can't make any assumptions as an organisation about what people want and need. So I think absolutely yes. I think it's increasingly being recognised more broadly as well. But Macmillan are doing a really, really great job in kind of being on the front foot in demonstrating how important that is within the UK. I can't really speak to sort of national policy making, if I'm honest, in that respect. What I can say from a policy perspective within the NHS is there certainly is an increasing recognition of the importance of the sort of psychological or psychosocial aspect of people's holistic care, and increasingly that kind of solution being incorporated into people's holistic care plans within the system itself, which is really, really great to see. As you can obviously tell, I'm particularly passionate about that aspect of holistic care. So yeah, I think the sort of the wave of change is happening. There's always more that could be done, and I would really challenge anyone working in healthcare to really think carefully about their role within that. And it just makes such a huge difference, and it could be just the smallest thing. Like it could be like literally a throwaway comment in a conversation with a patient, and that could be the like one thing that sticks with them and makes them realize that actually they need to think more broadly about their treatment.
Yeah. Thank you so much, Rachel. I see, Imad, you raised your hand.
Yeah, correct. Yes. Actually, I wanted to ask you, Janine, what almost the same question as you asked Christine. What influence, how your past journey is influencing your day-to-day activities and you as working in the pharma industry, and what keeps you from jumping into assisting CCCL every time we request anything from you?
Yeah,
So first the same question as Christine, and then what makes you come back always?
Sure. Thank you, Imad, for that. So I currently work with MSD, which is a pharmaceutical company. So to me, the difference is, of course, I enjoy my work and I enjoy the type of work that I do. But if I look around me, I see that I am even more driven with purpose than others because I've been there. So in the company I work for has treatment for cancer, has vaccines for prevention of cancer, etc. So I've been there. I know how it feels. I know how it's like. So it's more of a mission and the heart to heart, connection to what the patient needs by the end of the day, and being capable of fulfilling those needs in the best way possible. That's the key to it. Because as per the questions I probably asked the ladies, how do you see the patient's role in shaping policies probably on a nation level, but it's also for us as part of the healthcare system. It's important to understand what the patient usually goes through to be able to cater for solutions or for a medicine that works best for them. So it's more of a mission for me other than enjoying the job. And it was one of the main, let's say, reasons why I got into healthcare at the first place. So because of that journey, because of what I've seen, because of the experience I've went through. As for the second part, Ahmad, I mentioned, although it's been 20 years, I can assure you every single day that I pass by a UBMC next to the CCCL gate, it's just my heart beats, because in there, I've spent probably in that year more time than I spent in my own home. And the people there, which I am still in contact with, be it nurses, doctors, staff that were supportive, were so close to our hearts because they don't only do their job, but they care about the patients. So they come, they ask you about your day, they ask you what are you feeling? Did your brother graduate? Did your sister get married? They get so involved in your day-to-day life that they become part of who you are. And that's why we feel not only that we are grateful for the support we got in the center, but we feel that with any chance that we can give back in any type of way and shed more light about the efforts that such centers do, be it CCCL or other organizations that we've just heard of today, is extremely important for us. So thank you for the question.
Thank you.
I'm just trying to see if we have more questions in the chat box.
I have a question, Janine.
Yes.
Yes. Hello, everyone. I'm Dr. Lamia Mahmoud. I'm the Regional Advisor for Non-Communicable Disease Prevention and Focal Point for Cancer in WHO Office for the Eastern Mediterranean region. And I just want to thank everyone who has shared their story. It's really powerful, and I'm very much in line with the title of this event today. And it's really reached each and every one of us here listening today. So thank you for that. Thank you for your openness. I'm also thinking how moving forward, and especially the role of young people, because we don't want to just hear stories for the sake of hearing stories. We want to explore how we can also make these stories impactful in reaching to policymakers and in this, affecting decisions and so on, as has been articulated by just now. Especially by Christine and Rachel. I just want to ask, my question is specifically to Malak and Jad and Kiran, maybe, in terms of what are your needs so that we make, we build the capacities. It's not that I'm saying you need, but how do we really make you those champions that lead this work at the regional level, working with peers and young people, helping raise voices. I believe a lot in young people, and that's why I feel, hearing from you could really guide. It's not that I'm limiting it to you, but I just feel I want to know your thoughts. What are the capacity building needs that we should focus on to make sure that you are able to raise voices and be heard in a way that really impacts policymaking?
Malak, Jad, Kiran.
Yeah, can I answer?
Yes, of course.
Okay. The things that policymakers can do, KHCC always they try to do outdoors and more fun and physical activities when possible, so that they would take the patient's mind off the stress that they are in. As much as they can provide support, it's still you're still a patient, a cancer patient. You still have always stress, so they try to take that away as much as possible. Uh, Hearing other stories of cancer survivors and other cancer patients makes you feel not as lonely and not as like you're not alone in this thing. So socializing online and socializing in real life, even if you have the capabilities and capacity to do so, it's very, very, very helpful. Having like a peaceful surrounding and more like fun vibe around from the close people you have in your life, or even the organization that helped you through your cancer journey, it's always helpful to like relieve some stress and anxiety from your life. Uh, every support I got was like from KHTC or my parents. My classmates also, they tried to when I got finished with my treatment, they made me like a surprise party. It was so helpful. Of course, it was with organizing with my parents and my KHTC, so that they would know when it's possible. Because when I got finished, my immunity was so low. Doing stuff like that, it helps a lot with the physical and even psychological and mental health of the patient. It's always like better to take into consideration what you can do for the patient mentally and psychologically, not just treat them physically. Thank you.
Thank you, Jan. If I may, to reflect on also one point here, and at least I can relate to Lebanon. So alongside with the elements that Jad mentioned, with this, which is the psychological, social, and let's say emotional also support. In Lebanon, in particular, the financial burden is extremely high for a cancer patient to bear, knowing that with the downside of the economy, the coverage is not as optimal as it used to be before. So supporting centers similar to CCCL, for example, who usually cover all of the costs of the treatment, is extremely important, because at least with that, the patient and their family can focus on the patient themselves and not on how really can we afford treatments, or how really can we afford certain surgeries or transplants, etc. So that element as well in the country is extremely important.
Yes, taking out the financial factor out of the whole journey makes it a lot easier for the patient and his parents, to make it like more stress-free and easier for the patient to go through his journey.
Absolutely.
Hello. Can you hear me?
Yes. Yes,
I
yes,
also
we hear
want
you.
to add, can you see me?
Yes.
Yes.
Just to add to the question she asked and what he said, also just like a couple months ago when I was in my treatment, another kid came to the ward, and they allowed me to speak to him, and he just like couldn't stop crying. He had some type of cancer in his spine. He just couldn't stop crying. So I think also just a chance to, speak to him and share my experience, and for us to, have something in common. I think it helped him a lot, and be able to, and I was able to, kind of help his mind, and add some positivity, and also not only activities to take your mind off of the treatment, but also I haven't really. I know you just asked the question. I really got to think about it, but like some type of goals, like to maybe be some type of small goals, or maybe some type of like achievement you want to reach while you're in your treatment, that could get your mind off of it, but also like keep you goal oriented and doing something productive. But definitely being able to connect with your peers, and well, not peers, but other kids who are getting similar treatment, and give them positivity, and share experiences.
Totally.
And can
If
I?
may,
Oh,
sorry. No,
you
you
go for it,
Rachel.
Malak. Oh, was it Christine? I was just going to build on what Jad and Kieran have both shared there around the importance of speaking with other people going through something similar to you. So for me, as you could probably guess, I didn't have any sort of peer sort of connection or support. So I didn't know anyone of my own age going through something similar to me. It was only in the past 6 months where I joined a network of people who have had a cancer experience at my workplace, so where I've met Christine, that I connected with people who had a shared experience. It's taken me 15 to 16 years to get to that point in time, and it's incredibly powerful to be part of that network. And I kind of felt a bit of a sense of like loss for not having had that sooner, if I'm honest. Like it has made such a difference to be able to talk to people and kind of just share stories and know that you haven't experienced something on your own. Other people are experiencing something similar to you. So I would just really reinforce that message that it is so incredibly powerful to be able to share that with other people, with your peers.
And just from my point of view, if maybe stepping back a little bit from the question, at Macmillan, one of the key things that we advocate is co-designing services and, if possible, policy with people with lived experience. And I think this could be particularly important here if you're thinking about how to provide the best care and support for teenagers or children who are living with cancer. I think when you have cancer, it's very easy sometimes to feel quite powerless. And I think that can particularly be true for teenagers because they might not necessarily have the confidence that adults have. They might not necessarily have the communication skills. And also while they're developing and their sexuality is developing, they're having to, go through these scans. And I think it might be difficult for them to say, unless they're in a special center, like some of the places that we've heard about today, which has been wonderful. In many instances, they might not feel able to send back and trying to bring them into that co-design of services or of policy earlier on. So it can be built around what teenagers and children say that they need and they want. That be a really powerful way of doing that as well.
Thank you, Christine. I'll take one comment from Malak on the chat and then move to you, Elias. So Malak also, to that question, she believes that policymakers should involve patients in decision-making processes, given their experience and point of view that can provide very valuable insights in shaping the effective policies. So it's all about inclusivity, correct, to make everyone's voices heard. Thank you, Malak. Elias, to you.
Hello. First of all, good morning to everybody, or good evening to others. I'm from Lebanon. My name is Ilyas Hayare. Also, I'm a survivor from cancer. I just wanted to share a bit of my experience about the question you asked us. In my early, when I was, I didn't know that I had cancer. I was 3 years old when I start with cancer. So I was very young, didn't know anything. I wasn't capable. I was very young to think about it. In Lebanon, it was around 1997. There wasn't Lebanon wasn't so aware of, there wasn't any treatments for cancer, and cancer wasn't very known. That's why I asked Janine the year that she was diagnosed and got treated, because I went to many hospitals and there were no treatment for my cancer. I had Ewing sarcoma, which is bone cancer, and the treatment was very hard to find or to have one, even so in my case. So and CCCL opened in 2000 plus. So there wasn't any like solution for me to get treated for my cancer. I also had reached a point where I wanted to travel to America to get treated, or to have a treatment for my case. But the thing is, I just want to add that having friends, having the family, also the volunteering that used to have in the CCCL, those things were like making me feel like I'm at home, not a hospital. And this is very, very like one of the reasons why I think I made it through, because I had a reason to carry on, a reason to look forward, like build dreams. They teach you how to build dreams in CCL, to have something to hope for, something to wanna be, not just say no, I'm gonna die, or have that negativity in while having cancer. So these like family, the nurse, from nurses to volunteers to the team that works there, I think these points or these things makes you like look forward, having that hope that makes you carry on. Like I spent all my years in hospital, but I felt like home. I spent 14 years being treated with 3 relapses every time in a certain location in my body, from chest to brain to bone marrow. It was a hard experience. I'm not saying it wasn't, but I didn't feel it as hard as it is, because I had a family surrounding me, which made it like feel like better, even with the study and the educational thing. I also did all my education at the CCL, and I finished, and I went directly from CCL to university with no problems, because I had all my exams done there. So these things are crucial, I think, for any patient who has cancer. And thank you for letting me share my experience.
No, actually, thank you, Elias, for sharing that. Usually, when I meet someone that knows you from the center, I tell them, if you haven't heard the story of Elias, you haven't heard anything. So thank you so much. You're such a resilient, to me, hero for fighting 3 times relapse and making your way still despite it all. And to answer the part that you were asking me about, I was actually probably lucky. I was diagnosed in 2004. The center was open 2 years before that only. It opened probably in 2002. So I was lucky because, as you mentioned, also my case, I remember there was only one girl who had the osteosarcoma case that I had, and they made me meet her. And she was the only girl in the country that had my case. So imagine if I was not there, if I was in a regular hospital, probably they wouldn't have seen such a case before to treat it. And also in the surgery, the type of surgery that I had to undergo, it was quite a complex procedure that only 2 doctors, I believe, in the whole country knows how to do it. So also I was very privileged to have one of those doctors affiliated with the center to be able to operate and let's say save my leg, because otherwise we would have probably went to amputation. So these are the types of blessings that you count as you go and as you move forward. And definitely there are game changes in any person's life. So thank you, Elias, again. So if no other questions or comments, we have Mariam. Yes, Mariam.
Hello, everyone. Do you hear me?
Oh, yes.
Hello, this is Mariam Al-Harmoudi from Friends of Cancer Patients. I'm the head of community affairs. I would like to thank whoever participated today. You inspired us, especially in how to raise an awareness or how to deal with the patients, since recently it's added under my department, the moral support and how we can actually support the patients, not only the children, even the ladies and men as well. I have a question. I want to hear it from our warriors, to be honest. In terms of early detection or raising awareness about the childhood cancer in general, I know that I met Ahmad several times and we've discussed lots of ideas how to increase the awareness about childhood cancer and these kind of things. But I would like to hear from the rest of the audience, the rest of whoever shared with us their stories, how we can improve this part, especially in, let's say, in UAE. I don't want to say that I'm struggling in raising awareness among the kids, but I feel that there is a bit challenge from my side. So I would like to hear from you if you guys don't mind about that.
So Mariam, from my side, at least top of mind, when I was first diagnosed, I didn't even know what cancer was, let alone my diagnosis. So I was not that young. I was 13 years old, but I didn't understand what it meant to have cancer. So there are definitely a lot of ways. It's quite tricky, depending on the age you want to raise awareness for cancer for children. But there are ways that I also believe CCCL is now doing, as they are conducting sessions raising awareness on childhood cancers, but also more bringing hope that there are things that we can overcome, there are things that we can fight and we can survive. So I don't have a lot of information about the sessions. Of course, Imad or Rosie can share more, but I've heard about them, which is great. So it's making an impact. And it's sessions conducted at schools for the children to learn more about, cancer and survivorship and so on. Again, I iterate, it's tricky, but I think partnering with schools, partnering with universities, partnering with organizations like organizations that usually the kids collaborate with, like Scouts, for example. Those types of organizations can also help collaborate and foster more and more awareness about that. That's only top of mind of what I have, but I can hand it over to my fellow panelists as well.
I would like to say something about this.
Yes, Malak.
Basically, we can also raise awareness among parents and how to approach children about this issue. When I got, before I got diagnosed with cancer, at first, my school sandwiches, my lunch, they came back as if I didn't eat, I didn't drink water. I was for like few weeks, and my mom noticed later on, but she didn't think much of it. But later on, we were out with I was out with my parents, and then I came back home with a very high fever and swollen limbs, and I went to the hospital, and at first they said it wasn't that much. It wasn't. It's something normal or some sort of that. I can't remember much, but then later on, a CCCL doctor, which is Dr. Samar, she came and she told my parents that I have cancer. Now, the way they approached me, that I have cancer, at first I didn't know what cancer is. As you may know, I was 7. I told my parents that I can't go out and play with my cousins at first, and they were like, no, not now. You can do that another time, and they can still visit you though, but you cannot go out as much as you used to go. So the way that they approached is somehow understandable because of what their daughter went through. What I went through was nearly a death experience. However, I couldn't overcome it without my parents' support, without my mom's support, to be exact. And I remember my dad shaving his head for me, and it was a really nice memory to remember that. And overall, I think also, in conclusion, I mean, we should raise awareness on how to approach our kids if they ever encounter this experience. That's it. Thank you.
I'd also like to speak about this topic, please.
Yes, of course.
I think that in our modern time, there's no better way to raise awareness than online. So in my case, that was how I noticed I have cancer. It's kind of funny. I was sitting on my phone, scrolling through TikTok, and a video popped up. The name of the page was Men's Testicular Cancer Awareness or something like that. So in spite, I wanted to check, and funny enough, I had all the symptoms they mentioned. So I went to talk to my parents. I can't lie, I was ashamed at first. Not ashamed, it was pretty stressful because as a 17-year-old teenager, it's not easy to tell your dad you have testicular cancer. Okay, and so I gathered up all my strength and I went to talk to my dad. He was very supporting. He tried to comfort me at first. And as soon as I told him, he took me to the doctor, the family doctor, and he examined me. He said I should he referred me to another doctor who specializes in these things. I had a very, very long journey, including specifying what kind, if it was cancer or not. Because as you all know, I mentioned before, I have hemophilia, so they thought it was just I had a hit to it or something, so it had trauma. But no, they as soon as I got diagnosed officially with cancer, they all referred me to KHCC. And from there was a couple of bumps and obstacles, but it was pretty smooth. It was a fast journey because my cancer was very fast growing, and it was very hard to do the surgery fast, soon, because I had hemophilia, and you can't do surgeries without having to take multiple precautions first. I had to take my factoring agent, then I had antibodies to the factoring agent for my hemophilia. It was very complicated, but it all got resolved, and I had my surgery and it all went smooth from there. So overall, I just say in our modern time, the best way to raise awareness about cancer is online, because everyone has access to their phones, to the internet, to videos, even on the TV, to be mentioned on specific shows or something like that. It helps so much. I don't know. Only in my case, it was sent from God, I think, to have this video pop up on my phone, and I had a gut feeling that I should check. And funny enough, I had all the symptoms, but it was very, very, very challenging and very maturing journey. Thank you.
Thank you, Jean. Who would have thought, right? Scrolling on TikTok.
So there's a more complication because I think people also don't necessarily expect children or teenagers to get cancer. So in my case, and also in Rachel's case, we'd actually been ill for quite a long time, but people discounted it or thought it was something else. And I think that's even true. That could be true for parents who obviously might not think that's the issue or don't want to think it could be the issue. And even for doctors as well, we find that some people are getting diagnosed late because it's just not popping into people's heads that it could be cancer, even if someone's an adult, never mind if they're a teenager. So I guess it's part of it, would be the challenge would be that the tone, I suppose, to try to be hopeful and positive, which is a big theme that's come out of this morning, but also being very clear about, if you have these symptoms or if you've had these symptoms for a certain amount of time, to go and see the doctor and be checked for something. And it might not be anything. I think that's quite hopeful. It makes people feel a bit more relaxed about going to the doctor, that reassurance that it probably isn't anything, but that if it is, that it's really good to be seen early. Because again, I think lots of teenagers are diagnosed quite late, or children. So that might be a helpful message as well.
Thank you, Christine.
I could also add, so
We hear you, Kiran.
so from my experience, as I mentioned, my cancer, well, I figured out I had cancer when I was 16, which was last year, 2022. And I'm an athlete. I play basketball. So I was playing pretty actively, like, playing at a high level. If you know anything about Dubai, they have like clubs and academies and playing for that. And my symptoms started as you know, peeing, like I would have pain when I was peeing, and I would have like pressure on my abdomen, and it didn't really make sense. And come to find out, my type of cancer was Ewing sarcoma, similar to Elias, but it started in my pelvic bone. So it basically there was a mass that was putting pressure onto my bladder area, and then that's why I started to have pain when I was peeing. But I would just say, like, as far as the symptoms, it started in September 2022, and it went from like pain when I was peeing, and then getting CT scans and MRIs. So I was thinking, like, okay, this must be kidney stones or stomach infection. I didn't really realize the seriousness of it. And then December one day, my mom came home and she was on a Zoom with my dad. Like, she had just came from the hospital, and that's when they told me I had cancer. And I think, just like, if there was like just some type of information out there, because you never think it would happen to you. It kind of just happens out of nowhere. And I think it would have been, helpful to be kind of informed and not, you want to look up stuff on Google, but also to have some, like, you don't want to get everything from Google, because there might be some facts there that might scare you, or things like that. But there was information out there. I think it would have definitely helped me, and just awareness, and bringing awareness about it. Yeah, definitely would have helped me early in my process. But I think, yeah, off the internet, like a video, someone speaking on it, maybe they write in the essay, anything of their experience. Well,
Thank you, Kiran.
Can I add to what Kiran said?
Of course.
Yeah, I'd like to relate a little, because I was pretty athletic and healthy before I got diagnosed. So I tried to exclude having cancer as much, because it would basically destroy my athletic career. I was a professional swimmer for the athletic team in Jordan, and I was the healthy one in the family, as you can say. I had a pretty healthy diet. I trained 2-3 times a day. I always was caught up to the recovery that they provided at the national team, and then I got struck with the idea that I had cancer. So it was pretty shocking. But also I got a lot of support from the national team and from my friends at swimming. It was pretty devastating, you can say, to my career, because I had built everything, my scholarship to the university. I wanted to go study abroad with scholarship, athletic scholarship, but I got other plans now. I am studying in Jordan at the University of Jordan. You don't always know what's gonna happen, so be welcoming to anything, and don't block out, don't exclude, because I was in denial, you can say, at first. I didn't want to believe that I had cancer, as pretty depending on my athletic career, and then it got semi-destroyed by the cancer thing. But I'm still pretty athletic right now as a cancer survivor. I go to the gym, I eat healthy. Everything's going fine now. But being healthy like having cancer while you're healthy isn't something like nice to get told, because I didn't do anything that they say is causing cancer. I didn't smoke, I didn't eat sugar, I didn't eat fast food. I wasn't sitting around all day. But it's God's plan, as you can say. I have other plans now. And thank you
Yeah.
for it.
Thank you, Jad. So knowing that we are close on the closure time, allow me first just to thank you, dear panelists, for being here, for sharing all of your experiences, and also to thank CCCL for allowing me to be part of this session and to moderate it. So I will switch it over to Imad for the closing remarks. So Imad Al-Hajj is the Public Relations and External Affairs Team Leader at the Children's Cancer Center. Imad, last words to you.
Thank you, everyone. Thank you, Janine. It's a great panel. It's something that I wanted to do in order to be able to summarize what you just covered, and that it's a lot. I tried to take a positive points and a negative points from your journey. I see that the need is very much concentrating on the holistic approach of treating centers to the patients in order for them to recover fast and effectively. I see the need, as Christina said, or highlighted on, is the communication between the physicians and the patients, where it should be really much clearer and more humane, rather than just saying the news as it is. I saw that this applies to the questions from Dr. Mahmoud. The answers that came from the survivors. Dr. Mahmoud is emphasizing on the support or include the holistic approach to any policies you will be working with governments and institutions as a WHO regional office. Also, I would like to add on that that WHO should also try to support as much as they can civil societies, and not only governments. Civil societies are on the ground, they delivering services, as you saw, Doctor, whether in Jordan, in the UK, in Sharjah, and in Lebanon, of course. So it's them that are on the ground. I think their support is very essential to the survivorship or to the cure rate to be, as the Agenda 2030 applies, the third of the cancer increase by a third the survival rate of cancer patients. I also would like to highlight on the answers that Mrs. Mariam has raised, is raising awareness and how effective it is to those patients to, if they knew the information needed is before their diagnosis, they would have probably were faster in diagnosis. Yes, we have organized this panels as part of the awareness to the community. We organized these panels as we wanted, and the main objective is to actually raise the awareness, raise the voices of patients and survivors and their need post treatment and during the treatments. And I think we have achieved that thanks to the moderation of Janine. Thank you for all the organizations that supported this panel and assisted in providing survivors. Thank you to all the survivors, Christine, Rachel, Kiran. I don't know if I'm announcing the names correct. Thank you, Malak. Thank you, Jad. Thank you, everyone. Until next year. Thank you.
Till next year for sure. Thank you, Ahmad.
Thank you.
So with this, we can close our session for today, right in time. Thank you so much for everyone who joined. Have a good day.